So, somatic therapy or using somatics in therapy is a really interesting tool to take us past that point where we've been doing talk therapy for a while and it feels pretty good. We feel like we've got a good idea of what therapy looks like and we're making good progress, but there's still this thing that's not quite happening. And I think somatics are a really good way to push us past that point. In session, it looks a lot like maybe the therapist guiding you into what are you experiencing in your body. It's also the therapist acknowledging what we see, right? So I may notice as you're speaking on this specific topic that you become a little bit more fidgety, or you're breaking eye contact as we're talking on this topic. And just kind of a gentle observation of that sometimes allows the person to more deeply understand how this topic or issue is impacting them. And I think that's really powerful in our healing. I also think that that's a good time to use some skills. So somatics inside of therapy also includes skill building. So how do we soften that part of our body? How do we address this part of our body that feels uncomfortable as we speak on this topic? So sometimes there's some skills around that. One of the things I really love about somatics is how it moves us from feeling supported or learning how to support ourselves into learning how to hold ourselves. And feeling supported and held are different. And I think that somatics allow us to figure out how to hold ourselves a little bit more where we are, accept ourselves where we are, and move through really intense things without having to tell the story or talk about it or relive it. We get to just kind of go in through the body, give our body what it's looking for, the nurturance it needs, and hopefully find relief in that other way.